Hello and welcome. This video provides a streamlined overview of spinal anesthesia preparation and technique designed as a supplemental clinical resource for student-registered nurse anesthetists. Before you begin, ensure your emergency equipment is ready and apply standard monitors. For this technique, the sitting position is used. Ask the patient to sit at the edge of the bed with feet supported on a stool. Offer a pillow or rolled blanket for them to hug, and ask an assistant to help stabilize them throughout the procedure. Coach the patient to put their chin to their chest, flex forward, rounding their back like a cooked shrimp or the letter C. Identify landmarks by palpating the iliac crests and drawing an imaginary line between them at the L4 vertebral level. Assess for any curvatures and ensure you are midline. Before donning sterile gloves, prep the patient's back using DuraPrep. Start in the center and work your way out in a circular motion, covering the area you have selected for the spinal. Put on sterile gloves and drape the field using the included sterile drape. Unfold the drape and pull off the sticker. Shake the drape out and be careful not to contaminate it. Drape it so that the hole exposes your target. Next, complete your tray setup. Using the filter needle, draw up the 1% lidocaine in the 3 cc syringe and connect your fine gauge needle for skin infiltration. Then prepare your desired dose of bupivacaine. Some kits come without this. You may have to drop it sterilely on your field prior to your prep. Using your 3 cc syringe with your 1% lidocaine, anesthetize the skin and subcutaneous tissue. Raise a wheel at the puncture site, then infiltrate deeper to improve patient comfort. Using a midline approach, insert the introducer needle between the spinous process, angled slightly cephalad. Ensuring your bevel is up, pass the spinal needle through the introducer, advancing slowly. You'll feel increasing resistance through the ligaments, followed by a distinctive pop as you enter the dura. Remove the stylet to confirm free flow of cerebral spinal fluid. Reposition if cerebral spinal fluid does not appear. Stabilize your position by bracing your hand against the patient's back and pinching the port with your index finger and thumb. Carefully attach the syringe with your prepared bupivacaine. Aspirate to reconfirm cerebral spinal fluid. You should see the volume increase in your syringe. Then inject the medication slowly over 5 seconds. Remove the spinal needle and introducer together as one unit. Apply gentle pressure with sterile gauze to the puncture site. Immediately reposition the patient according to the baricity of the local anesthetic and the surgical procedure.